everyone. I'm Li Ying, one of the Healthcare Scholarships Officers with Healthcare Scholarships and Talent. A warm welcome to Healthcare Scholarships Virtual Experience 2021. For some of you who have attended the earlier sessions, welcome again and thank you for joining us in this segment. Throughout the 2 weeks of virtual events ending on 3rd March, you will get the opportunity to participate and interact with scholar ambassadors, scholarship officers, university partners, and professional representatives from various public healthcare institutions. We have an ongoing leaderboard and games section for participants to win attractive prizes such as Universal Studios Singapore one-day pass, Disney Plus subscription, GrabFood vouchers, and many more. There are many ways to earn points, such as by attending programs, asking questions, and playing our daily games. Welcome to Learn and Explore Nursing with National University of Singapore. In this session, you will get to learn more about the Bachelor of Science in Nursing curriculum at NUS and hear from student ambassadors about their life as nursing students. Before we begin, if you have any questions for our speakers, please feel free to type your questions into the Q&A box. If you'd like to direct your question to a specific speaker, please kindly indicate it in your question. Lastly, if you see questions that you're interested in being answered, please upvote the questions. We will have time for Q&A at the end of the session. I will now hand over the time to Dr. Serawan Lim, Senior Lecturer from the Alice Lee Center for Nursing Studies, NUS. Dr. Lim, please.
Yeah. Thank you, Lee, for the introduction. And good morning, everyone. I shall share my PowerPoint screen first. So, good morning, everyone. I'm Dr. Sriwan from Alice Lee Center for Nursing Study, NUS Nursing. And with me today, I have the MOHH scholars, and they are Joshua, Cheng An, An Ping, Rachel, and Boon Hui. Right? So together, we will be sharing this session with you all. The Q&A will be answered later on. So let me begin by sharing with you the video of our graduates throughout their career trajectory after they have graduated from our degree program. So can we play the video first?
I first started my degree at ALCNS in 2009 and I finished my studies in 2012. Being a pediatric nurse is very different from caring for an adult. They have different wants, different needs, and we have to really care for them in a very special way.
I graduated from ALCNS with Bachelor of Science in Nursing with honours. Now, I'm currently full-time first-year PhD student and I'm interested in exploring the field of research in nursing.
I was an A-level student who graduated and then from JC and went on to pursue a Bachelor of Science in Nursing at NUS. Currently, I'm a nurse manager. My primary responsibilities here are to identify clinical issues or clinical problems, be it personal, social, or due to work, and to sort out these issues.
An advanced practice nurse is an expanded role of a registered nurse who does physical examination to come up with a diagnosis for the patient and eventually to come up with a treatment plan in collaboration with the medical team.
As an undergrad in ALCNS, we have been taught to advocate for our patients and to have critical thinking to make decisions in our clinical care, and also to exercise autonomy as nurses to make decisions for our patients which we deem best for them.
ALCNS actually gave me a really precise overview on what a nurse should do. They also taught me things like professional ethics, professional practices. The faculty is very strong, the teachers are very kind. A lot of them are ex-nurses, and I think that says a lot about their hearts.
The program in ALCNS, although it's quite rigorous, but it's very comprehensive, and I'm sure that having to go through this process will actually help me to be a better nurse scientist.
What is unique about ALCNS is that it's actually part of the Yong Lulin School of Medicine. The interprofessional education through simulation was effective because we learned to communicate with fellow friends from other professions.
With ALCNS in NUS, it helps nursing profession to move forward. We are no longer nurses who are task-orientated, but we are nurses with knowledge to help become advocates for our patients in their care.
For students who want to pursue a degree in nursing, I would strongly encourage all of them to join ALCNS because Ellerslie actually provides and prepares its students to become future leaders in an industry that we all love.
Okay, thank you so much for playing the video. And as you can see, our nursing students have actually made a lot of progress upon graduation, and they can actually choose to work in whichever hospital that they want to work in, and that they can make their own career pathway from there. So upon graduation, our nursing graduates will be eligible to register with the Singapore Nursing Board to have the license to practice as a registered nurse. So just like any other professional occupation, like the doctors, the dentists, the pharmacists, our nursing students are also considered professionals upon graduation, and they need to be registered with a professional body like the Singapore Nursing Board. For students who are interested to pursue nursing as a career, those with O level, they can actually join the polytechnic to do a diploma in nursing. And for those who graduated with diploma in nursing, they can progress to apply to do a nursing degree in ALCNS and NUS nursing with us. A-level students are also eligible to apply to pursue this nursing degree with us. So we have done very well over the years as a faculty, and we are ranked number 2 in Asia under the QS World University Ranking. We have a very vibrant faculty whereby our faculties come from various disciplines with various specialty as well as research experts as well. So over the years in NUS, our nursing student intake have increased over the last more than 1 decade, from 50 intake all the way to about 300 today. So indeed, we are growing as a faculty, and we would like more people to join us. And our aim is actually to produce nursing graduates who can be healthcare leaders of the future. Our nursing graduates, upon graduation, they can start work as a staff nurse, and there is a few career trajectory which you can consider. So one trajectory is to go into the management aspect, clinical or education. So if you are interested in pursuing the management track, you can actually start with as an assistant nurse clinician or senior staff nurse, and you progress on to be a nurse manager, senior nurse manager, and subsequently assistant director or director of nursing, right? Similarly, for the clinical track, you can start as a senior staff nurse, and you can progress to be an assistant nurse clinician, and then you can move on to be an advanced practice nurse, as well as moving on to be an assistant director and director of nursing. Okay. For education track, similarly, you can progress to be a nurse educator, senior nurse educator, and subsequently to be a deputy director of nursing as well, or eventually the director of nursing, and ultimately at the pinnacle here is the chief nurse. So in ALCNS NUS nursing, we have a 3 years undergraduate program with additional 1 year for those who want to do honors. And in the year one, our core nursing module, we will prepare the student with the fundamental of nursing and the pathophysiology, pharmacology, and nursing practice, whereby we ground the students in knowing how to care for the patient based on their knowledge from anatomy and physiology, which is covered under the basic science modules. And subsequently, we also want the student to practice what they have learned in school by going to the hospital for their clinical attachment, right? Some essential skills that we want to equip our student with include health continuum for older adults, comprehensive health assessment, so that students are equipped to carry out comprehensive physical assessment of the patient, and how to communicate effectively as healthcare professionals. So in year two, our students will continue with our core nursing module, and that is the pathophysiology, pharmacology, and nursing practice 2, whereby we cover different systems of the body at different level. Okay, basic science module include infection and immunology, and our specialty skill includes mental health nursing, women and children health in year 2. Similarly, we would like the student to go to the clinical for their attachment to apply what they have learned in school, and therefore we have the clinical practicum. Okay. For year 2, the essential skills that we want them to be equipped with is knowledge about professional practice, ethics and law, medical sociology, and also psychology for nurses, because we are dealing with patients' life, and we are dealing with people in the community as well. Patients who need to be nursed in the community instead of in the acute hospital, looking at the aging population nowadays. So in year 3, the student will cover the last module of the core nursing module, that is the pathophysiology, pharmacology, and nursing practice 3. In this module, the student will progress to learn about critical care, emergency care, oncology care. The essential skills for nursing practice in year 3 will be modules related to leadership and management, community integrated healthcare, research and evidence-based practice to prepare them to undertake research when they graduate, and also for those who are interested to pursue their honors years. The student will be exposed to clinical practicum, whereby they have to start shadowing the registered nurses before they graduate to be junior registered nurses. So these are the modules in year 3. Now, I would like to take some time to share about our employment and salary statistic, because I'm sure everyone who graduated would like to make sure that they are able to get employment and they are able to get salary that they are happy with. Yeah. So I'm very pleased to share with all of you that all our nursing graduates, upon graduation, we have very high employment uptake, between 98.8% for those with honors and 93.5% for those with the undergraduate degree. The percentage is a bit lower because some students prefer to stay on to undertake other courses or undertake some other specialty. Okay. Now, for the median salary, as you can see here, our nursing graduates actually, the salary are pretty competitive as well. So those with honors, they can graduate with 3,600 salary per month, between 3,003 to 3,006 to 7. Okay, and of course, on top of the shift work and special allowance, they earn more than that. Now, this is another slide that all of you may be interested in terms of scholarship. So we have two main types of scholarship for nursing students, the MOHH scholarship and the hospital sponsorship. So over the years, you can see that our number of students who are given MOHH scholarship and hospital sponsorship have actually increased. And by year 4, about 80.3% of our students have some form of sponsorship. So in this slide, I just want to share with you, if this is definitely on your mind right now, what kind of entry requirements to apply to do our NUS nursing degree program. So for A-level, at least 2 H2 passes in biology, chemistry, computing, physics, and mathematics. For polytechnic, GPA score of about 3.5. Okay. Yes, we will require our applicants to undergo some form of interviews when necessary, and also to take the aptitude test. Yeah. Now, for more information, we would like to invite you to join our NUS Nursing Open Day 2021 and to register for our e-open house webinar, whereby you can interact and ask more questions with our students and also our alumni who are able to come back and share with you what they have learned in their journey upon graduation. So the link is here. I think that's all I have to share for my PowerPoint here. I will hand it over to Li Ying.
Okay. Thank you, Dr. Lim, for sharing with us on the nursing degree program at NUS. Next, I would like to invite the following speakers who are current students from NUS Alice Lee Center for Nursing Studies to do a sharing. First, we have Goh Boon Hui, Year 2 nursing student, Rachel Ang, Year 3 nursing student, Wu An Ping, Year 4 nursing student, Joshua Lim, Year 4 nursing student, and To Cheng An, Year 4 nursing student. Boon Hui, please.
Alright, so thank you, Lee. So hi everyone, my name is Boon Hui. You can call me Athena as well, and I'm a Year 2 nursing student. So I was previously from Singapore Polytechnic, Food Science and Technology, a course that was actually totally unrelated to nursing. When I first told my teachers in Singapore Poly that I wanted to join nursing, they were very doubtful, and they were saying like, why are you gonna start again from nursing when you already had 3 years of polytechnic life? I told them that I was very sure of my choice and I wanted to do something to help the community, to help people. Thus, my teachers actually encouraged me after that to go and pursue a degree in NUS and to actually take on the scholarship as well. My friends and family were very supportive from the start, as they knew that I wasn't someone who could sit still as the day goes by. I needed to move around, I needed to walk. So nursing is actually not just about study, it is also about the bonds you make during the study itself. In NUS nursing, we have 10 houses, and I'm in Orem. From this picture, it was actually a trip to Pulau Ubin itself as a house trip. So we as housemates actually support one another and encourage each other to push on when the going gets tough. So apart from my housemates, the friends I make during the scholar camps and events also support me during these 2 years of studies. MOHH has given me many opportunities to get to know different healthcare professionals and in different fields, and we get to learn more about what they do. The networking sessions really allow me to learn a lot and to actually make more friends as well. So, well, being a scholar is not just about studying. We have to take a break from every now and then. So I do volunteer during my free time itself, helping mental health patients clean their houses and playing with kids who stay in the hospital, or even serve the community by joining NHS and PHS, where we go to the community and provide medical service to the residents there. I find exercising is one of the ways to relieve stress and also to build up stamina. To keep my mind sharp and focused, I do play games from time to time. As they say, all work but no play makes Athena a dull woman. So after all that I've said, the most important question you will have is why nursing? Firstly, the personal satisfaction that you get when you help a patient, the smile on the patient's face, on the family's face, to know that their loved ones are being well taken care of. Being a nurse allows me to build communication with my patient by their bedside. When good communication is achieved, the joy of treating patients would definitely increase. Lastly, nursing provides a wide variety of career paths, from research to practice to even educations. Nurses can get to choose from over 50 specialties and so many hospitals in Singapore. So with that, I thank you for your time and I can't wait to meet you soon. Next, I'll pass on to Rachel.
Hi, good afternoon, everyone. I'm Rachel. I'm a Year 3 nursing student, currently bonded to Tan Tock Seng under NHG. So for me, right, I am also a polytechnic graduate. I come from Ngee Ann Poly, and I did a diploma in pharmacy science. So during my time I really enjoyed being in the healthcare industry, and it was really fulfilling and interesting. Not just studying about the drugs and the medications, but also the patients themselves. So if not for my crave to do more, in a sense, like to interact more with patients and to have the opportunity to kepo into their lives and find out how they live and how to help them, I'll probably still stay in pharmacy. But not saying that pharmacy, there's no meaningful interactions with patients, but in a hospital, especially in an inpatient setting, nurses will be the ones who would interact the most with the patients, especially when my friends and family and polytechnic teachers, they point out that I really do have a flair for interacting with patients, if I do say so myself. So yeah, especially with elderly, and they can see me as a nurse working in the future lah. So that was how I began my journey with nursing by joining ALCNS as a nursing student. So there was the opportunity to explore nursing in other specialties too, which is really interesting, such as on this photo on the right. That was when we were doing a module about mother and child. And then on the left, this was a specialist outpatient setting where we got to explore what is it like to be a nurse at a skin center. So being in ALCNS really helped to broaden my horizons, and I learned to be more independent and accountable for my own studies. Because unlike in poly, where learning is still quite guided and you just have to study whatever that was given to you, in nursing in university, that's really not enough. So you have to really learn through reading up, paying attention, asking questions in class, and you yourself decide how much you want to learn. And for that, I would say you got to stay hungry and not be content with what you already have and know, but to always want to find out more. So as a scholar as well, MOHH provides the opportunity and avenue to enrich my life as a scholar through opportunities such as CIP engagement events, networking events, and most importantly, there are opportunities for personal growth and development as well, such as induction camps that we have and overseas CIP opportunities as well. So through these events, I've learned a lot more about myself as a person, but also as a healthcare professional. But of course, at the end of the day, it's really about being a nurse and a patient, like, and your interactions with your patients, right? So the most memorable experience from my 3-year journey thus far are from my clinicals. So especially as a student, there's lesser workload, and we really get the liberty of interacting with patients, especially when I interact with some of the patients that other nurses label as TLC, or what we call tender loving care, which is basically like a quote that nurses use for patients who might be a bit more fussy or a bit hard to handle lah. But after interacting with them for a while, I realized that that's not the case, and they are not intentionally being fussy or being hard. It's just that they are worried and they are concerned, and it's expressed in a way that we interpret as being fussy and difficult. So after a while, when we do talk to them and reassure them, we find out that they really are just trying their best to do what they can, and they are really thankful for us as well. And it's times like this when you find that nursing is a really rewarding thing, and times like this, I am reminded of why I joined nursing in the first place. So I want to end off with a quote that every nurse was drawn to nursing because of a desire to care, to serve, and to help. So if that is something that applies to you as well, I hope you can consider nursing as a future. So with that, I'll be passing my time on to An Ping, a year 4 nursing student. Thank you.
Thank you, Rachel. I'll share my slides. Okay. So, so I am An Ping. So I am currently in year 4, carrying out my research year. So that's what we call our honors year. And I'm formerly from junior college. I took A-levels and I chose nursing as my first choice. So when you're deciding to join nursing, these are some of the things that I actually considered on my own. And it was a decision between what I wanted, and then I went on to seek opportunities to figure out if that is really what I wanted. So the first thing that I knew that I wanted in my future job was that I wanted my skills that I learned in school to be practical, which is why I think nursing was a good choice, because there's a lot of hands-on. So if you see from the photos, this picture of us in the blue uniform is actually us engaging in our lab skills for pediatrics. And the picture next to it is us completing our clinical attachment and practice in a pediatrics ward where we took care of a lot of babies and children. So you can see how whatever you learn in nursing school is transferable to the real life situation and your real job, which keeps me interested in what I'm learning. So another reason why I chose nursing is because I value the social interaction with others and being actively involved in the care of others. So I think everybody can agree that nursing is a very people-oriented job, not just with your patients, but also with the people around you, your colleagues. So we call ourselves shift mates, or everybody who works in the same shift, and we work together in order to complete all our patient care. So I really value the camaraderie that we have with each other. So another reason why I opted for nursing is because I was very interested in the biomedical aspect of it. So it was about how diseases work, how the body functions, how the medicine that you use actually can change a person's condition. Then another thing that I valued was that I have opportunities to learn about a lot of diverse healthcare topics. So as I said, we took care of babies, children. We also went for emergency department. And then we also went to IMH to learn about mental health. And in the regular wards in hospitals like Tan Tock Seng, we also managed to take care of elderly patients or surgery patients. And lastly, how I decided that I wanted to join nursing was by gaining a lot of exposure, because I think that you can read a lot from the internet about what nursing is like, but you never really know until you actually go for these kind of attachment opportunities. So what I did was that I went for hospital open houses, volunteering at hospitals, and I took some shadowing opportunities where I followed the nurses around for the day in their daily routines. I also went to interact with some of the people in the field. So as I'm attached to Tan Tock Seng, so you can go to the Tan Tock Seng website as well, because they have regular open houses, and I'm sure that the other hospitals have those as well. Okay, so for why some reasons why you might want to consider the MOHH scholarship is because firstly, you get to meet friends from different healthcare professions. So the first photo is actually a photo of me and my friends from the scholarship camp that we had, and I still keep in contact with quite a few of them till this day. So these are the people that you get to share your healthcare experiences with, and you have common interests as well. So another thing is that MOH scholarship gives you financial coverage and stability. So I managed to attend an overseas healthcare course on global health in London because of the MOH scholarship. Then some of the valuable points, I think, is that it gives you an existing job offer when you graduate, and also allows for early interactions with future co-workers and exposure to your workflow during your schooling years. So I've seen my group of friends next to those points. Those group of friends have been with me for the entirety of the 4 years. So I've seen them quite a few times in work, and I really know how I can get along with them and how we can work together because of the MOH scholarship. So I'll end off with some of the challenges I face in the course. It's definitely, you cannot lie that because it's in nursing and you're taking care of other people, the workload is quite heavy and knowledge intensive. And opportunities need to be sought by initiative and by chance, because you see, because the chances are not or arranged for you, and the responsibility of the patient is on you. So some of the things you can do to prepare for it is just to make sure you plan ahead, manage your responsibilities, and make sure that you work well together with your friends. Yeah, so it's not easy, but I think I really gained a lot from joining nursing, but it's based on your own personal preference as well. So just consider carefully, and if you really join nursing, then I hope you have a good time here too. Yeah, so now I'll pass the time to Joshua. Thank you.
Okay, thank you, Amping. Hi, good morning, everybody. My name is Joshua. Previously, I was from Diploma of Aeronautical Engineering in Singapore Polytechnic, and afterwards, I make a switch to nursing. The spark of this change came during the time when I was in Singapore Polytechnic. During my year 2 of studies, I actually went over to Thailand to do some humanitarian trips alongside with some doctors and nurses. So seeing how the nurses, how they care for people, I think that is the kind of satisfaction that I look forward to and want to translate it into a career. So fast forward till right now, okay, I'm already in year 4 nursing. Throughout this nursing journey, okay, I was given the opportunity to organize an OCIP to Malaysia in Sabah, Sapulot, to serve the rural villages over there. All this would not have been possible without the help of MOHH. Okay, so the bottom of this, okay, the motivation that keeps me going is that I believe that there is no higher calling than serving the health needs of our people. So come join us. This work promises you that what you're doing is for the greater good of humanity. This work has purpose, and the achievement that you can get is something that you have to join us to experience it. Thank you very much. I'll pass on the time to Zheng An.
Okay, hi everyone. I am Zheng An, a year 4 nursing student, and I'm very happy to have all of you here with me today. So in the following slides, I will bring you through my journey as a student nurse and as a MOHH scholar. Okay. So this was the Healthcare Scholarship Award ceremony for 2017, which was the year I was enrolled into nursing. And this was another photo that we took during the ceremony with Minister Amrin. And this is the Nursing Scholar Engagement Meal, which were frequently organized by our scholarship officers. This is the SHS Sports Day. The SHS is formed by the MOHH scholars, and they constantly organize cohesion events and community involvement programs for scholars to participate. Okay, so we will come back to MOHH later, and I will now share about my nursing journey as a student. So this is my classmate during year 1. This is another photo. They're really amazing people, which I had a lot of fun with. So we decided to take the "You are the apple of my eye" photo here. So this was during the med search class where we take turns to role play as either the patient or the nurse. You can see Dr. Siriwan here, and she taught us this module. This was during the anatomy and physiology lessons, which was really interesting as you get to see cadavers. So this was during the comprehensive health assessment. This one as well. So this was during my posting to the psychiatric ward. This one is to the pediatric ward. Okay, this one was during the exam day where most of us will do some last minute revision before entering the exam venue. This was the neighborhood health service, which was an initiative by the medicine student. So we participated in it as well, and we took part in the performing community screening for the residents at Kampong Glam. And during my second year, I went back for the healthcare scholars induction camp, but this time as a facilitator. And this was during year 3, and these people are my closest friend in school. So this was the year 3 posting to the respi ward, and it was an interesting posting as you can see that there's only males here because all our female classmates went for Ops and Gynae posting. So these are more photos that I had with my friends. These are the photo shoot which I had. This is another photo shoot with the medicine student. I think the emphasis is now on interprofessional collaboration. So we actually had a module where we worked together with pharmacy and medicine student. So this was taken during my transition to practice, which was the longest posting I had yet. We were learning from the advanced practitioners here, dressed in dark green, on how to perform neurological assessment. This was taken during the community integrated healthcare module, which I enjoyed a lot. During this module, we shot a short promotional video on how we could improve care for community residents with renal failure. So in the video, we have to act as elderly. So I think the girls did a good job as makeup artists. And this was after a presentation. I also took part in a film to raise awareness on the mental health. So this was a snippet of the film. This is the place me and my friend went to overseas summer program, which was part of a development program sponsored by MOHH. This was in Cinque Terre in Italy. So the place is very beautiful, and this is the actual photo taken by me. Okay, so this was me during the hike. More photos. So this was in Venice. So we actually managed to go there before the flooding and COVID. This was the Colosseum in Rome. I think this was also in Rome. This is in Murano. After that, we went to England with another group of friends. So this was in Brighton. So I finally got relief of my duty as a photographer for a while. And then we went to Dover, which is the coastal town in England, during one of the weekends. So we went past this old medieval castle, which we missed during the touring hours. I think I repeated this photo. So after that, we joined a boat party in London. And then we went for some musicals in London, which is a must go if you go there. So this is my last slide. I actually have many more experience to share, but due to the time, I will have to stop here. So to summarize, my 4 years in NUS nursing as a NUS nursing student and as a MOHH scholar was extremely eventful, and I had enjoyed every single moment of it. I would like to end here with this catchphrase: I'm proud to be a nurse. Care to join me?
Okay, thank you students for all your sharing. We will now begin the Q&A session with all our speakers. Feel free to post your questions to any of the speakers using the Q&A function. You may want to specify who you'd like to direct your question to if you have a specific speaker in mind who you'd like to hear from. So we have quite a number of questions that are already in. So for the first question, will be directed to Dr. Lim. Perhaps you can share, will all applicants who applied for the nursing course at NUS, do they need to go for the interview?
Okay, that's a good question. Not all applicants will need to go for interview, but we do want to interview those whom we feel like are interested, but we just want to make sure that we are getting the right applicants for our course. So we may want to interview those who are interested in nursing, but may not put nursing as their first choice. So if you're really, really interested in nursing, please put nursing as your first choice when you apply for the course. There's another question, I think.
Yes. So for the difference between an APN and a nurse clinician as well as a nurse manager, would you be able to share more?
Okay.
Yeah.
So let's talk about the APN first, the advanced practice. The advanced practice nurse is a very special group of nurses because they are specially trained to be able to make diagnosis and give prescription as well, but they must be specially trained. That means they have to undergo the Master of Nursing for 2 years in our NUS nursing school, and they have to be under internship before they can be fully qualified to be a practicing APNs. So they work closely with the doctors and they're able to undertake responsibility of a junior doctor. Yes. Whereas for the nurse clinician also work very closely with the doctors, and they look mainly into the patient care in the hospitals to make sure that quality care is being given. They look into the nursing practices and all that. Nurse manager look more into the management part of the running of the wards. They look into the manpower, they look into the budgeting and all those. Yeah, so it's more of the management role. I hope that answered the question.
Yeah, thank you, Dr. Lim. Yeah, I think you have touched on all the different aspects for nurse manager, APN, and nurse clinician. Okay, we will move on to some questions for the scholars. Okay, what are the difficulties students like yourself usually face during the course? Maybe Boon Hui, you can go first to share some difficulties that you've experienced so far.
Okay, so I think one of the difficulties I had was having to touch on biology, because I did not do a lot of biology in food science and technology, so it was quite a new area for me. However, with the help of my teachers, friends, and fellow scholar members, they actually like taught me the basics of the immunology and helped me through my revision as well.
Okay, thank you, Boon Hui. Maybe Rachel, would you also like to share some challenges or difficulties that you faced?
Oh, so for me, right, it's a more recent challenge with regards to the COVID-19 situation. So all of our classes have moved online, and it was a challenge to get used to it because as a very physical, hands-on kind of learner, right, I crave that being in that physical environment. So like being in class physically, and then going for tutorials in real life, being in the lab, and then seeing everything, right, was the best way that I learned. So now that everything was online, it took some time to get used to it and to like adjust my learning environment, and like so I have to adapt and try and become more comfortable with Zoom, and also having like really the self-discipline to sitting through the classes, not fall asleep, and yeah, stuff like that. And I think the school has been very very helpful in trying to help us get through this difficult time as well, by trying to accommodate to us. They give us like more details about like how our examinations are going to be adjusted and stuff like that, and give us the support that we need like through this difficult time.
Okay, thank you, Rachel. Yeah, I do think that with the pandemic, it's become quite the new norm that lessons have moved online, and it's probably it's not just for the nursing course, but also other courses as well. So this would be a general move towards online lessons, which all students will need to be prepared to get accustomed to once you start university life. Yeah, so I'll move on to the next question. This one is specifically for Joshua and Zhen An. Can you all share what is the gender ratio in your cohort, and are there any challenges faced as a male nurse? Yeah, maybe Joshua, would you like to go first?
Okay, so the gender ratio, okay, from last that I saw from my cohort, we have about 300 students. So there were about 30 male nursing students. So it's about 10%. Yeah,
Okay.
if I remember correctly. Okay, so the next question, are there any challenges faced as a male nurse? I wouldn't say it's challenges, but it's more like there are some differences when it comes to actual work. What I mean is, so for example, currently now in Singapore, male nurses can only take care of male patients. If you're looking into areas like ops and gynae, gynae, okay, sorry, ops and gynae, then this specialty is not open to male nurses for now. Yeah. Other than that, I would say in the ward, I think naturally because of our physique, if we need to lift a bit heavier things, then probably they will ask us to come and step in and help them. Yeah. So yeah. So maybe anything?
Yeah, I generally agree with like Joshua. We certainly face certain restrictions, such as not being allowed to tend to female patients alone. But we are usually assigned to care for male patients, which I find that is a good thing for the patient as well, because I find that most of the men will be more comfortable with having a male nurse to care for them over female ones. And yeah, we are generally considered like stronger than our female counterparts, so it's advantageous for us as we are less likely to get injured when performing manual activities such as during patient transfer. So generally, I feel that there are more advantages as a male nurse than disadvantages.
Okay, thank you, Zhen An and Joshua. Dr. Lim, perhaps in your years of teaching at NUS, did you see any increasing trend of male students in the NUS cohort over the years? Yeah.
Oh, yes. Definitely. We are seeing increasing number of male students coming in, and we are very happy to welcome them, because we really appreciate our male nurses' presence in this profession. They bring a whole lot of different perspective in, and they are really a good team player as a whole, right? Not just to carry heavy things, but it's just to see them coming in and not allowing this profession to be like mainly seen as a female dominant profession. It's actually a professional occupation whereby male and nurses are all welcome.
Okay. Yes, thank you, Dr. Lim. I would like to also echo that, and to the male students who are interested in nursing, don't let the current ratio of male and female students deter you from joining. You can be the one who join the profession and make a difference, and encourage younger male students like Chen An and Joshua who join us today to join the nursing profession, even though you are male. Yeah. Okay. So the next question, maybe I can this is specifically for Joshua. Since you were from a non-healthcare background, how did you manage to perhaps switch to nursing, and perhaps share some tips on how you make the switch? Yeah.
Okay, how do I make a switch? Okay, so it is a very big decision for any polytechnic students who want to change course. Those who are in the polytechnic will know that if you choose the same course as what you did in poly for your university course, you get 1 year off. But if you make a switch like what I did, essentially you start from zero. You start afresh. But having said that, right, there are some transferable skills that you could bring over. So, like for example, like people management. In the polytechnic, you are given a lot of exposure to that. So when I came over to nursing, there were a lot of difficulties I faced, but it is like people management. When I'm doing group work, all this will come to play, and all this experience, previous experience will come to play and help me out, and also to benefit the people around me. Okay, so that's about it now.
Okay, thank you, Joshua. I do think that for students who are not in perhaps health science or nursing related courses right now, and you are thinking to move into nursing, do speak to people whom you know who are in a nursing profession. Do your research to find out more about the program before joining it. And if you are very sure that you want to pursue this course, do not let it deter you that you by thinking that you are not you are someone without nursing background, because if you compare to like JC students, they also do not have any nursing background. They are only taking like general sciences or maths, and even for NUS nursing, I believe that in their year one they do conduct basic modules for all the year one students to pick up the nursing skills, essential nursing skills. So don't let that deter you, or don't let that prevent you from joining the nursing profession if you're really interested in it. Okay, we'll move on to the next question. Okay, so this can be answered by any of the students. So some of you all have went for clinical placements and practicums in hospitals. So how important it is to know dialect to be able to effectively communicate with the elderly? So maybe Amping, would you like to share first? Do you have any experience interacting with elderly whom you had difficulties communicating with?
Yes, I think it's definitely a barrier. There's always going to be a language barrier if you don't understand the other language properly. So because we have in our hospitals, usually I'm going to Tan Tock Seng. So usually in the hospital, there's a large proportion of elderly patients who can only speak dialects such as Hokkien, Cantonese, and then some we have Malay patients who can only speak Malay and can't really speak English, or patients who can only speak Tamil. So there's definitely a problem with a language barrier. But over time, I think you pick up, because of how many times you go for clinicals, you pick up certain words and you start getting familiar with the language. So there is a barrier, but I think you can overcome it. And also in school, they provide these dialect courses in school for you to sign up. So you can also go for that. So I don't think the language barrier should be a deterring factor for you lah. Yeah.
Okay, thank you, Anping. Zhen An, do you have anything to add? I see you nodding quite a bit during Anping's response. Yeah.
I feel that there is certainly, yes, there's a barrier, and it is definitely not possible to be able to learn every single language out there.
Yeah.
As diverse as our patients can get, we also have a diverse nursing population as well. So usually in the ward, if you are unable to convey our message to our patients, we usually will have other people translate for us, and there's definitely people around that is able to speak that certain dialect or that language. Yeah, so it's not an issue at all. And
Okay.
regardless it's MOHH or the school, if you're interested, they are always like organizing all these dialect or even sign language courses which you may sign up.
Yeah. Thank you, Chan and I'm Ping. Yeah, so for MOHH, we do offer regular dialect classes which our scholars can sign up, and we will actually sponsor you to attend these lessons because we do understand that dialects are quite a common language spoken by elderly, and they may not be able to understand English or Chinese or Malay or Hindu. And based on your own racial background, you may not speak such so many languages. So we do encourage our scholars to go for more dialect classes or even third language courses. Yeah. So the next question, perhaps Dr. Lim can address it. So just now during your introduction, you mentioned about students having to go for placements and practicums. So an audience would like to know whether there is a minimum requirement for a student to go for internship or placement at a hospital, and is it freely chosen? Yeah.
Okay, thank you for the question. So in our NUS nursing undergraduate program, all our nursing students are scheduled to go for their clinical posting. It's all arranged by the school, but students have to pass their core nursing modules in order to be eligible to go for the clinical posting. Yeah, the school will arrange all their posting, including liaising with all the relevant hospitals, all the specialty they need to cover for the curriculum. So it's all handled by the school. So you don't have to worry. Once you are enrolled into our NUS nursing program, all this clinical placement will be taken care of by the school.
Okay, thank you, Dr. Lim. Okay, I think it's about time, so we'll take one last question. And this one, I would like to get the student speakers to share. How did you know that nursing was the right choice for you? Rachel, would you like to go first?
For me,
Mm.
how did I know nursing was the right choice for me? It's really the interactions with patients, like that moments of like rewarding experiences. Then you're like, yes, I joined nursing now. But of course, there are also days where we're like, sian, why did I choose nursing? Wow, I'm doubting my career decisions. But it's a balance of both. But most of the time it's towards the rewarding side. Then when you're feeling a bit sian, then you complain, ventilate. It's very important to ventilate. You ventilate to your like shift mates and to your friends. But yeah, they also remind you why you are in nursing in the first place. That was me my clinical experiences.
Okay, thank you, Rachel. Yeah, maybe Boon Hui, do you have anything to add for yourself? How did you know that nursing was the right choice for you?
I think I do agree with Rachel. Like it's the tiny experiences that the patients give you. And for me, I actually joined the healthcare outreach project, which is usually held in December, where I actually get to experience different kinds of healthcare professionals before I even set foot into nursing itself. I really get to explore like what are the different allied health available and why I really wanted nursing.
Okay, thank you, Boon Hui. Yeah, so what I think the healthcare outreach project is one of the programs that NUS students offer for A-level and polytechnic students to experience some of the NUS courses before you actually enter university. So it's usually held in December every year. You might want to just check out and see if you can find any activities on it nearer the end of the year. Okay. Ping, would you like to share why did you choose nursing? Yeah.
Yeah, so for me, I think the most important thing was that I didn't want to be seated for my job because I like moving around. Yeah, and it was so I enjoyed the practicality of the nursing job. Because previously I was in St. John's, so I really enjoyed the process of like wound dressing. I like learning about the medical management of conditions. I liked home nursing. I like taking care of people. Yeah, so I think it really depends on your personal preferences and from what all the other scholars have said about their experiences. Yeah, then you can consider carefully and decide whether nursing is really for you.
Okay. Joshua, how about yourself?
So actually, I do share similar sentiments with the other scholars who are over here. But I'd like to share something a bit, a small story that is personal to me. Okay, I'd like to share with all of you seated in front of the screen. So actually, back when I was in Polytechnic year 2, so that is about almost 7 to 8 years ago. I was actually in Taiwan doing this winter internship. So previously I was studying about planes. So I went there, do my internship, and then in the cold winter, I was actually fixing like nuts and bolts on planes. I spent a good long about 8 hours there just doing all this, just honing our skills. And then at the point of time, I thought to myself, like, 10 hours fixing machines. Why don't I spend 10 hours fixing a person, seeing the health of the person improve? So fast forward, when I actually went for the clinical attachment in Tan Tock Seng Hospital, what happens was, I see myself, I see this change. When I go back home, after like this shift work in Tan Tock Seng, I would think about the people they have taken care of. I wonder how is their progress? What is stopping them from recovering? Is there anything else that I've left out? And all these feelings, okay, I go to sleep, and the next day it will carry me. And then when I go back to the ward, it makes me want to see back the patients again, and seeing them recover. It is a kind of satisfaction that it is not just mere words can be described and explained to you over the screen. So it's something that you have to experience it. And for me, this experience has solidified my own what do you call it, enthusiasm for nursing. Yeah, that's all.
Okay, thank you, Joshua, for your personal sharing. Chun An, any last sharing for yourself in terms of why you chose nursing? And
Okay, so actually my story is very long, so I'll just try to be short
yeah,
here. So okay, I believe that nursing is a calling. It's definitely a calling, and there's a reason why every nursing student chose nursing. For me personally, is definitely not passion. I mean, it was a passion for me, but I did not choose it based on that it was a passion alone. I chose it based on the reflection on whether at the end of my career, when I look back, what are the differences that I made in general? Because I believe that passion will definitely change, and I do not want to base my career choice based off a passion which might change one day. So I want to base my career choice based on like whether at the end of my career, when I retire, when I look back, what is the differences that I've made. So it's definitely healthcare for me, because I know that like regardless of whichever path I choose, I'll definitely make some change and to which healthcare profession. I explored it through the healthcare induction programs and all the job shadowing. Yeah, so at the end of the day, I chose nursing. Yeah, and that's where I am here today.
Okay, thank you, Chun An, and thank you to all the scholars who shared your reasons for joining nursing. I do think that everyone comes from a slightly different motivation. So be it whether you crave for the patient interaction, you would like to see people get back on their feet, and you like to help people to recover throughout their process in the hospital or in the wards, and even personal stories that motivate you to join nursing as a profession. I think there are many different reasons why people join nursing, and at the end of the day, I think nursing is a very meaningful and rewarding career which students can explore if you're interested in healthcare. And one of the ways, like Dr. Lim shared, if you are interested in nursing once you're in NUS, be it whether you're already a nursing student or you're intending to join nursing, you can apply for scholarships or even sponsorships that are available in provided by MOHH as well as the different public healthcare institutions. Yeah, so we have addressed quite a number of the questions, so it's about time, and I'd like to thank the speakers for taking time to join us today. So thank you so much to Dr. Lim as well as the nursing students and scholars, and I'm sure that the audience has benefited from your insightful sharing today. We have come to the end of this session, so if you have enjoyed this session, to the audience, please take a few seconds to rate this program at the bottom left of your screen. Our next session, Learn and Explore Podiatry, is happening this afternoon at 2 p.m. Join us and the guest speakers from the University of South Australia, podiatrists from Singapore's public healthcare institutions, and current students to learn more about this allied health discipline, the course structure, and student life. We look forward to seeing you at our upcoming sessions. Go on and have fun as you learn to dare to care in our online seminars and virtual activities. Thank you once again.
Thank you, Ling. Thank you,
Thank
everyone.
you.
See you all in NUS Nursing.